lot of health issues as well as reduction in the lifespan, disability adjusted life years. That means the period loss due to premature death as well as disability adjusted life. That is periods that is we are becoming bedridden or incapacitated due to the health problems. So considering the disability adjusted life years, so autoimmune disease is a big challenge. Let me move on to my slides. Autoimmune disease, these things are already discussed here. Autoimmune disease, the presence of immune response against the cell tissue. Autoimmune antibodies are easy to detect. The mere presence of autoantibody is not equal to disease, and absent doesn't exclude diseases. So I'm just showing the slides, organ specific and systemic autoimmune diseases. All these points have been discussed here. And I'm presenting few cases of hypothyroidism, that is autoimmune thyroiditis, Hashimoto's thyroiditis. You know, hypothyroidism, there are primary and secondary, and the cause, primary, the problem is thyroid itself, and secondary is due to TSH deficiency. And the primary with goiter, it is a cured. Hashimoto's thyroiditis, Anti TPO will be positive. And ATD means anti-thyroid disease treatment. And goitrogenic exposure. Primary with atrophic glands, that is atrophic thyroiditis. And interpretation of thyroid function test. I'm not going in detail. High TSH, with normal TSH, low TSH. I given the comparisons. Right. So this is a case that I treated, a case of Hashimoto's thyroiditis, Anil TPO was positive, and the patient, the first prescription was on 7/7/12. The patient came to me with TSH as 46, and I treated the patient with Nexomica 1, and within 2 months, you can see the drastic reduction in the TSH level, that is 5.47. And this patient is basically was transferred from Bombay to Delhi, and they came to a hospital for homeopathic treatment only. And it was a diagnosed case of with Anti TPO positive as well as high TSH level. She was having the typical features of hypothyroidism, including menstrual irregularities, constipation. So, based on totality, I prescribed Nexomica and started with 1 and after 2 months, when I repeated, the TSH level reduced to 5.47. But later on, the patient shifted to other city, so I didn't get a follow-up of that case. The second case, this is a case with a 46 male, and the TSH level was 10.119, and T34 level was within the normal limits. And I started the case with sulfur 10 was given, and have repeated. Generally, I repeat after 2 to 3 months, because most of the cases when defatting medicines are given, so I repeat after 2 months. And generally, the way I follow is I have treated around 30 to 40 cases of hypothyroidism, including a few cases of Hashimoto's. In many cases, I have not tested because of the the investigations are very costly, and in the government setup there is no facility. In the hospital in which I was working, there was no facility to repeat the test and all. So most of the cases the patient have to do from the pocket. So those who are affordable, I push them and tell them to go for Anti TPO. Otherwise, based on TSH, I have treated around more than 30 cases. So what I used to do is constitutionally I prescribe, and I give the medicine. After 1 to 2 months, I repeat the medicine. Later on, after 3 months generally. Otherwise, if the patient is having any other issues, worsening of symptoms, I may test before that. Otherwise, generally, I repeat the test after 3 months. In most of the cases, 2.5 to 3 months. So, same is the case here also. So you can see the the difference in the values, and later on the patient I have followed till 2022. I have followed that case. Okay, the patient was normal. And next case, that was also anti TPO positive. Yes. I will explain. I will explain one case. Okay, one case I will explain. See, basically, I prescribe based on physical generals and mental generals. In most of the cases, the prescription is based on physical generals and mental generals. Because I believe homeopathy is not a black magic, homeopathy is a science. If I can prescribe, everybody can prescribe. There is nothing like that. Okay. So if it is a female patient, I give importance to physical generals, especially menstrual history. I take in detail. Okay. Then Baki in physical generals, I ask specifically about desire, aversions, bowel habits. Then sleep, dreams. If any particular dreams are there, okay. Because some of the patients say general dreams, day-to-day affairs, but there are in few cases you will get repeated dreams. Okay. In such cases, I give importance to dream. This is the way I generally prescribe. And case 3, it is case of 43 female, and again 7 plus was the TSH level, and it has been reduced. Case 4, a lady, 60 was the TSH level, and EDP was positive, and started the case with sulfatanum, and I repeated after 3 months. That is the first report is in 24/2, and the second is 8/6, June 8th. So it has been normalized, and the patient is still on follow-up. Right now, what I do is generally after 1 or 2 years the patient is normal, I ask the patient to just repeat the test after a gap of 6 months, provided she is not having any symptom. If she is having any symptom, I will tell her, or the patient is having any symptom, I generally advise the patient to repeat the test. Otherwise, once in 6 months. If fine, there is no need to repeat the medicine. If the patient is having any abnormalities in the values, generally I repeat the medicine. This is the way I follow the case. This is actually she's the first patient, the friend had. The first patient was under treatment from me, and then she approached through the friend only. She came to me, and I will explain this patient. She's a 30-year-old lady, and she was a known case of hidradenitis suppurativa. Already Dr. Bodhi explained here about hidradenitis suppurativa. She was having it in labia majora. Hidradenitis suppurativa, it's a chronic pyogenic infection with pustular formation as well as nodule formation in sinus. It is a very disturbing condition. Common location is axilla. Okay. So generally, isotretinoin is prescribed by allopathic doctors. Isotretinoin is the effect of reducing the sebaceous secretion. So that is because isotretinoin has got a lot of side effects, especially in young ladies in the fertile age group. There are a lot of side effects for isotretinoin. And she came to me for the treatment of hypothyroidism, and I prescribed Nair. I started with the Nair. One reason was she lost her father at a relatively young age, and the way she interacted with herself, she was a very secluded type of personality. I will tell you, she's still in contact with me, and last month also she came for treatment. Even though there is interaction of 6 to 7 years with me, she's still at distance. He's an income tax officer basically. So very secluded type of personality here. And the reason I prescribed Natromol was, one is desire for salt was very marked, and this was salt as well as milk. Then, as I told you, she was a heart patient, and history, the mental history, mental agony, I explained. Okay. And the other is in Natromol and body you can see greasy, oily air. Greasy, oily, in hairy part. Okay, that is in boric it is given, I think it is in italics. Okay, and one more thing, skin eruption discharging and skin eruption pustular. In both these rubrics, Natromol is 1 or 2 mark. So these are the reason I prescribed Natromol, and she responded well, and simultaneously her hydrogenated suppurativa also recovered. Otherwise, she used to at least 6 to 7 days in a month she has to take isotretinoin, sorbitol, sorbitol. I mean, sortate. Sortate is that was the name of the medicine that she was taking, the trade name, sortate. But now the reason, because it used to ulcerate, there is to be discharged quite frequently. So whenever there is, aggravation is there, inflammation is increasing, she used to start with medications, isotretinoin. But right now there is no need of taking isotretinoin, very rarely. And after a gap of 1 year, 1.5 years, she came to me in last January. At that time, TSH was raised, so I have repeated the medicine. And I think I have given in proteum potency. Okay, she has not yet reported after that, but otherwise she is stable. Again, 15.36 was the level of TSH when she visited me, and medicine was Natromol. It is an error, typographical error. Nexomica is the medicine. I have repeated Natromol only, then increase the potency. So this is a typographical error, Nexomica terminal. I have followed the case till end with Nexomica terminal. Sorry, Natromol terminal, sorry. This patient still I am in contact. This patient is known to me, and have given sulfatanum initially. Later on, increased, raised potency to sulfur 50 m. The patient is still stable symptomatically, as well as based on TSH level also, the patient is stable. Again, this patient, same. I started the case with calcaricum tendon. 10.93 was the level. Now the patient is stable. The case number 9. And this also strongly anti TPO positive. This patient was also anti TPO level was around 600. And the patient, the first value I given 10.13, and later on I didn't get the follow-up after 2019 in this particular patient. Again, this case TPO was anti-TPO was positive, strongly positive, 473. Initially it was 15, and I started with the patient with the sulfur 10 m. Then repeated the report, This was an interesting case. He came to me after COVID. His TSH level was very high, 219, and phosphorus subscribed. And within 2 months, 2 to 3 months, 2.5 months, it is reduced to 29.37. But I didn't get the follow-up after that. In between the second wave of COVID, as well as I got transferred from the institution, so I didn't get the follow-up. This is a case, the patient was on hormone replacement therapy with thyroid 50 mcg since 2019. And he came to me in 2021. So gradually I tapered and reduced the dose of thyroid and started medication. And he was on 50 mcg. So I started with the dose of calcium 10 and after 2 weeks I told him to make it in alternate days and gradually stopped the medicine. Within 2 to 3 months, gradually stopped the thyroid and he's on calcium 10 now. This is latest report, that is on 11/3, March 11th, this year only. This is the latest report. You can see the result. He was also anti TPO strongly positive, but the patient is stable. So this is about diet in hypothyroidism. Cruciferous vegetables, that is leafy vegetables including cabbage, gobi and all should be avoided. Then this is about the cases, totally cases. I have presented here 11 cases. Okay, among the 25 cases that is seen, these are the medicines usually indicated. The maximum cases have treated the sulfur, then calcarea, natrium, other medicines are phosphorus, naxomic acid force. These are the medicines in which I have got response. And as usual, females are more affected, and age group that I treated. The next case is rheumatoid arthritis. Most common causes in inflammatory arthritis, and mortality is around the same to 15 years. Less, lifespan is comparatively less or 8 to 15 years in case of rheumatoid arthritis. And these are the, previously you are following American Rheumatic Association score. Now this is the latest European League against rheumatism. This is the score. So the patient with a score more than 6 or more than 6 are considered to have definite RF. 4 to 10 small joints, 5 is the score, and ACPA positive, low positive 2, high positive 3, and duration, and abnormal CRP or ESR 1. In my case, 4 joints were affected. I am showing the slide next, and SCP and ECCP was positive, and ESR was raised. This is the case. It was already a case of hypothyroidism, and ESR was 52, and she was having pain in both hands and both elbows. Swelling was marked, and ESR was 52. This is the reason I suggested to go for anti-CCP, RA factor. RA factor was negative, but anti-CCP was strongly positive. Or anti-CCP was 15. Till 5 was the normal, 15 was for anti-CCP. And I started the case with the sulfur 1 was the prescription that I gave. And later on have added Angostura vera tincture. Angostura vera is very effective in joint diseases. Stiffness and tension the joints mark. You can see from Boric. So that was the reason, because you are having early morning stiffness was very marked, okay, and pain. So that was the reason I gave her Angostura vera. So Angostura vera and Macphos was continuing, and I have repeated. After 2 months again, sulfur 1 and Angostura vera. Then I repeated the test. Anti-CCP was negative. The test was repeated in January 14th, 2014, January. And the ESR was 50 plus, ESR was reduced to 31. And symptomatically she was better. And after that in 2000, she repeated the ESR, you can see it is 29. So the repeat was done in 2019. So then I'm discussing a few cases of vitiligo. Vitiligo is an autoimmune disease, as we know. It is actually idiopathic depigmentation disorder. Well circumscribed milky white macules. Incidence is 3 to 4% in this population. Genetic factors. Vitiligo trichrome. Vitiligo trichrome is vitiligo. There will be no. Vitiligo trichrome means vitiligo you can see depigmented lesions, hypopigmented lesions, and normal skin shape, skin color lesions. This is vitiligo trichrome. If this is a differentiating features, in many cases of vitiligo, you will get vitiligo trichrome. Previously, vitiligo and leukoderma was used synonymously. Now, dermatologists are not using so. In leukoderma is usually destruction of melanocytes, generally because of any chemicals. You know, in building sport it's very common in the area of wax trap because there is a chemical called monobenzyl hydroquinone, MBH. This is used, and MBH is having destruction of melanocyte destruction property. That is the reason. So if you want to differentiate a case of leukoderma and vitiligo, this is one point. Then based on the location and all, okay, this is vitiligo trichrome. That is 3 colored lesions will be there: depigmented, hyperpigmented, and normal pigment. And vitiligo type focal, segmental, acrofacial. Acral, you know, end parts, that is acral. Between the extremities and face, acrofacial, acromegaly, acrometria. Then vitiligo vulgaris, generalized, acrofacial, vulgaris, lip tip, which is affecting the tip as well as canine tip, vulva, this is typical. Localized, focal, 1 or more macules, segmental, number of macules in unilateral segments. The clinical staging, this is very important as far as the management of vitiligo is concerned. I have taken the PNL, textbook of PNL, and active stages, that is new lesions developing, lesions increasing in size, borders ill-defined. Okay. So I have observed when we are following a case, so I can perceive if the case is responding. You can see the second one, the quiescent stage. No new lesion developing, lesion stationary in size, and border hyperpigmented well defined. So based on that, you will be getting an approximate idea the patient is responding. And the third stage is improving, lesions decreasing in size, no new lesions developing, borders defined, and signs of spontaneous repigmentation, follicular and pedicular. So this staging you remember, so it will help you when you are following a case in the patient, how is the response. So this is a case of vitiligo I treated. So this is a 15-year-old boy. He came to our OPD in 2016. You can see. So I have treated him with the sulfur. Hyperpigmented patch first appear on left since 5 years back, then spread further. The prescription was constitutional, and this first use were very marked. He was a heart patient, but habitually constipated. This was the reason I thought of giving sulfur, and you can see the difference. It took almost 1.5 to 2 years. I was to take photos in which every 2 months, 3 months I will take photos because there used to be mild improvement. So I have shown the photos in which there is a marked change. You can see the latest photo that I took in 2021. Okay, all the lesions are clear. His hand is his right hand. So complete repigmentation has happened. And this is the thumb, but also you can see the difference in the reduction in the size of the lesion. And this is angle. So you can see the difference, 2016 and 2019. And that was the latest, 2021. You can see the difference. This is a case that I am still following. This patient came to me just before the COVID in December 2020. You can see the first photo, and I prescribed calcaria carb. So during the COVID time, he didn't turn up. So later on, he turned up after 6 months. Then you can see the difference in these two lesions. As I told you, the lesions are become very clear. The boundaries are marked, well defined. Initially it was ill defined. Later on, it was become well defined. Right? I think the photo is very clear to you. So the stage is 2. That is active, from the active V1 state to V2 state. Active state to V1 state, the patient has gone. Again, I will take you. Then the second stage of COVID happened. Okay, the patient started coming to me. Then he came to me after about 1 year in 2021. So you can see the difference. So especially on the outer side, near the outer canthus, the lesion, you see. You can see the lesion in outer canthus, right? This is the latest photo. This has disappeared completely, right? In 2020 and 24. So you can see the 21 the photo itself. In the photos of 21 itself, the size is reduced. I hope this is clear to you, right? Then one more thing, you see the lesion has reduced in size, and you can see now the latest photograph two separate islands of lesions. The lesions are totally separate. But in this case, these lesions are interconnected. Two lesions before on upper eyelid, lower eyelid, the lesions are interconnected. So this is taking photo from me. So what happened is that in 2021 he came to me 7/10/21. After that I got a transfer, and the patient discontinued, and he was taking treatment from some other doctors, and he was given many medicines. Okay, later on he came to me in 2023 June, and I have given calcaria carb to him. In between he was given many other medicines, and calcaria carb plenum also was given somebody else. So, but there was no response. So I gave a dose of tuberculin 200. Then I started again calcaria carb plenum. So patient is responding. Then you can see the latest photo, and you can see the lips. So I think the lips speak better, because I came to see many, because his father is running a grocery shop, and the child also used to sit the father, and through their reference, because they should have noticed the difference in lesion. So obviously they should ask what treatment you have taken. Few other cases of vitiligo and other conditions came to me. So that is why I told you the lips speak better. So this is the lesion on abdominal wall. You can see the difference. This is a case of segmental vitiligo. You can see the lesions. It's an obese patient, and I treated him with calcaria carb, ternum. You can see the difference. So one thing, I already told you. I mean, this is not a black magic. Very simply, when I am sitting in a busy OPD, I generally give few points. So thermal reactions, desire aversions, bowel habits, sleep dream. As I already told you, menstrual history. Menstrual history I take in detail. Okay, when I used to ask the number of pads you are using, because the people it's a heavy flow. Because what I understand is 4 to 5 pads per day is normal, especially in the initial days. Because many ladies used to come to say even they have 3-4 heavy flow. So if you want to assess it properly, you have to ask properly. And I used to ask constipation, diarrhea, headache, associated symptoms during menstrual. So Baki, regarding, because the way you elicit the symptom, that is important. Because I don't know, constipation we used to ask, but I specifically asked in constipation, first part of heart. There are 3-4 medicines in cancer putri, like lycopodium, calcaria, and bowel stuff. Stool first part hard, then soft. If you ask, few patients say that. So the way you interrogate the patient, the art of interrogation is very important. Generally patient constipation है, so Delhi में very काफी common है, सब लोग बताएं constipation है. So आपको नेक्सोमिटा सल्फर वगैरह देना ही पड़ेगा. But you specifically ask the nature of the stool and any associated symptoms. So what I used to do generally constipation, जो भी symptom है, I generally refer repertory and the symptom that is available and refer from Boris and other textbooks. Based on that I prescribe. So it's another case. This case also I treated. You can see the difference. So the stage 1 to stage 2, very clear eye, right? So the lesions are very irregular and bizarre, but on the second stage you can see the lesions are very clear, the borders are marked, there is no new lesions are coming. So that is the stage 2. That is so. This is the last one. The same patient, you can see the difference. Thank you. If you have any queries, you can ask. That I know I can say. Yes. So.
Hello, sir, you.
अलग रिपोर्ट